Thank you, Mr Deputy Speaker. I'd just like to start by saying this government has been a strong and certain government that has delivered outcomes for all Australians. It's been very clear with this COVID pandemic that it's about saving lives and livelihoods. And as the previous member has just said, the global pandemic that has been COVID has been an incredibly complex, fast-moving, changing situation. So in order to deal with something as complex and as uncertain as this, I'm very proud of the fact that the Morrison government has delivered certainty and it has been able to pivot when pivoting has been required. And we know that pivoting has occurred all around the world. Let's start with alpha variants last year. We could see that the Australian government had the right approach. We understood from the very start that Australia needed to close its borders, firstly to hotspots in January and February, and then to the world, because we knew that that was the right public health activity to undertake to save lives and to save livelihoods. And we've also been very clear from the commencement of this COVID pandemic that it is the dual balance between those two issues, getting that balance right. And as we've seen with the Delta variant this year, we've had to move to a different way of dealing with this virus. So when we look at the issues of quarantining, for instance, we know that the world is changing with the way it's dealing with its international travellers. We know that as the COVID vaccination coverage increases in countries, those countries like the US and the UK are changing their returning travellers' requirements. And we know that that is likely to happen too here in Australia. But the first thing to say is that closing our international borders was a strong public health measure that was undertaken, quickly followed by good quarantining measures and contact tracing, and then we've moved to physical distancing, and then the most recent, which is the COVID vaccination rollout. Now, I know which leadership I would prefer to have on this side of the House. I know that the Morrison government is committed to delivering for each and every Australian. And those on the other side, hindsight can be a wonderful thing. But let's talk about what this government has been doing with regards to saving lives and saving livelihoods. We've delivered PPE and COVID testing. We're now delivering a COVID vaccination that is ramping up at enormous speed. But we haven't done it by taking shortcuts. We've understood that to bring the Australian people with us, we need to make sure that this COVID vaccine has been through the appropriate testing. And we know that our Therapeutic Goods Administration, the TGA, is absolutely world-class. And we've methodically assessed each COVID vaccine as it's come online, and we've made sure that we've made it available in the right targeted way, which is ensuring that the most vulnerable in our community are protected. So when we look at the UK, for instance, and we're seeing the AstraZeneca COVID vaccine rollout there, we're seeing that the AstraZeneca COVID vaccine rollout is working. For instance, there's been 3 waves of COVID outbreak in the UK. The second wave had its peak January the 1st, 2021. Unfortunately, at that time, before the COVID vaccine rollout in the UK, there were 50,000 cases of COVID. That was before the Delta variant, 50,000 cases. And there were 1,500 deaths each day, roughly 1,500 deaths with 50,000 cases. Now, the AstraZeneca vaccine rollout was done with great urgency, emergency approval was given, understandably. 1,500 deaths approximately every day in the UK. And if you look at that, if that had happened here in Australia, a country just half the size of the UK, a bit more over half the size of the UK, you cannot even imagine how many deaths there would be here in Australia. Now we get to the third wave that the UK has recently seen, and again they had a peak of around 30,000 cases of COVID a day. But what they saw, or what they're seeing, is a peak that's less 100 deaths a day. Terrible, each and every death is terrible, but they've been able to disconnect the cases from the fatality rate. And they've had to do that because they didn't have an aggressive suppression outcome that we have had here in Australia. So this third wave in the UK has seen a success. We've seen that the vaccine rollout in the UK is working to suppress fatalities in the UK, and that is something Australians should take heart from. And we need each and every Australian to go and see their GP, work out which vaccine is right for them, put their arm forward and support the Australian government and its rollout of the COVID vaccine rollout, because that is what is going to get us to the other side of this COVID pandemic. That is what is going to get us out of lockdown. That is what is going to get us back to our normal way of living. And I'd like to see those on the other side not talk down the government's response, but support and back in AstraZeneca, because it is a vaccine that's TGA approved, that is safe, Go and see your GP, get your vaccine, get the one that's right for you. Thank you, Mr Deputy Speaker.
All right.